my name is Kayla. I'm your nurse today. I see that you are to get a head-to-toe assessment. Do you know what all that entails?
No, I don't. What is it?
Okay, I'll be happy to explain it to you. So what it is that we do a thorough head check all the way to your feet. We check your lung sounds, your heart. We check for your capillary refills. That pretty much means that I press on your finger or your foot and see how quickly your body refills within that time frame. And I check your skin integrity and make sure that you're nice and hydrated. Overall, it's just to make sure that you're nice and healthy.
Okay.
I see that you do have the consent form filled out for me right here.
Yes, I do.
Okay, perfect. Let me go ahead and sanitize my hands and get started. And do you have any questions for me before I get started?
No, ma'am, I don't.
Okay, and if you feel uncomfortable or have any questions, you feel free to ask me or stop me, okay? I'm gonna turn on this light so I can see. Is that okay?
Yeah.
So like I said, we're gonna start with your head. So I'm just gonna check your scalp. Let me know if there's any itchy spots that you had, anything that's bothers you, anything that hurts. So let me just press your scalp for you and look at it. Anything hurts while I'm doing this?
No.
And I'm gonna check out your neck and your ears as well.
Okay.
Anything hurt around your jawline? Or?
No.
Okay. And so what I'm gonna do is just grab this and I'm gonna look in your ears. Nice and healthy. And I'm gonna look at the other one. Nice and normal. Uh-oh. Alrighty. And if you can just bite down gently, I'm just gonna feel your jawline and your temples. Alrighty, perfect. I'm gonna grab my pen light, and it's just to make sure that your pupils are equal dilation. If you can stay focused right here for me. And I just want you to do a quick follow with me. Follow the pen light for me. Wonderful. Alrighty. I just want to make sure, I'm just going to go through your neck. Anything tender, your neck, any lymph nodes or anything? And I'm right here. I just want to check your nose. Make sure you don't have any deviated septum. And if you can stick out your tongue for me. Perfect. All right, while I'm here, I'm just going to look at your arms. I'm just working on down, making sure everything is equal. If you can flip your hands back for me. All righty. Any tenderness in your arms, your limbs?
No.
Okay. What about your shoulders?
No.
And what about your back area? Anything hurt?
No.
All right. So what I'm going to do is listen to your lung sounds and your heart sounds. I'm going to have you breathe in and out for me. And I'll let you know when you can do that. Let me just get everything adjusted. If you can breathe in for me and out. In and out. And what I'm doing this for, to make sure that you don't have any wheezing or crackles in your lungs, to make sure everything sounds very fluid. Okay. So everything's this. If you can cough for me. Okay, everything sounds nice. And I'm gonna listen to your heart. And your heart sounds nice and normal and steady. Alrighty. Okay, and after listening to your lung sounds and everything do sound nice and normal, are you on a ventilator or anything, or?
No, I don't have any trouble breathing.
Okay, perfect. And that was the only question I had. Let me check your pulse. Alrighty, I'm gonna wrap that down. and I have 62 as your pulse rate. What I'm gonna do, you stay right here. I'm gonna check your blood pressure while I'm already right here. You can slide your arm in for me. That's nice and comfortable for you?
Yes.
And we're halfway done. Let's see, my thing has had some issues. I believe it's right here. Let me see. So what I'm gonna do, this one has a malfunction. I'm just gonna simply switch it out for you. Let me switch it out real quick. I'll see what's wrong with that one. That one right here. If you can swing around for me, ma'am. I'm gonna put that cuff on you. And that's nice and comfortable. Alrighty. Alrighty. Okay, perfect. I have 120 over 80. That's nice and normal and healthy. Okay. And while you're right here, what I'm gonna have you do, I'm gonna check your muscles. If you can just swing back over here, I hate to move you so much. I'm gonna check your legs. Okay, and while you're right here, I'm gonna check for your muscular skeletal strength. If you can kick both legs up at me, and then one at a time. And does anything hurt?
No.
Any muscles, any joint?
No.
If you don't mind, I'm going to check for edema in both of your legs to make sure that everything is nice and symmetric. I'm just going to feel for them. Does anything hurt? I don't feel any warmness, so that's a good sign. I don't see any swelling. And do you mind if I remove your sock?
Oh, no, go ahead.
Okay. Right here, I'm just going to check. I'm going to look at your nail beds. Everything looks nice and normal. I'm going to do a quick capillary refill, and then you can put your sock back on. Perfect. Within 3 seconds, and I'm going to feel for your fetal pulses. Wonderful. I can put your...
I'll put it on.
Okay. And I give you a minute to put your sock back on. And then I'll just switch over and check your other foot.
Okay.
There you are.
Thank you.
Just looking at skin integrity. Everything looks nice and normal. Capillary refill. Perfect. And I'm going to feel for your pulses. Wonderful. Thank you. I'll give you a moment to put your sock back on.
Thank you.
You're welcome. And while you're in that position, if you can go ahead and lay back for me, if you don't mind, I'm actually going to move on down to your stomach area. I'm going to listen to your bowel sounds, your stomach. How is your diet normally?
I'm going on a light diet, so I only try to eat chicken and rice and salads.
Okay. And you had any problems with digestion issues, anything that may cause you any constipation or anything, diarrhea?
No, not at the moment.
Okay. And what about your urine while we're on that topic? How's your urine? Any pain while you urinate? Is it nice and clear, cloudy?
It's nice and clear.
Okay. And what about your water intake?
I try to drink a gallon a day.
Okay. I'm just going to listen for your movements. Everything sounds good. You stay right here for a second. I'm just going to palpate. Make sure you don't have any. Is it fine if I touch your stomach?
Oh, you're fine.
Any tenderness?
No.
Alrighty. Alrighty. You can just sit up for me. And I know that you already have your shoes off. I just want to check one more thing. I want to check your gait, meaning your walk. If you can walk in a straight line for me right here. Perfect. Does anything hurt?
No.
Okay, and you can have a seat for me. And while you seated, if you can do this and try to push against me. Okay, and grab my hands. Grab them. I want to check your strength.
Okay.
Okay, perfect. Nice, good strength. Okay. And I see everything looks normal. No problems with your head, nothing with your neck. Everything with your skin looks nice. I'm just going to double check your skin integrity. Alrighty. And I think we have completed our assessment.
Okay.
Before I get finished and wrap everything up and document everything, is there any questions that you have for me?
No, I don't.
Well,
All
I'll
right.
see you next time.
You
Thank
too.
you.
Have a great day.